Hi everyone, this is Samit from Chico Hospital for Cats and Dr. Colleran with me. Hi, doctor.
Hi, Samit.
So we just decided this spontaneous podcast because we're going through these unusual circumstances and times. We figured it would be a really good time to talk a little bit about the COVID-19 and as far as, cats a little bit too.
Yeah.
Lots of people have questions. Lots of people hear some rumors or maybe not so true, misinformation everywhere, not to know where to look. And so we figure we can have you here today a little bit and talk about cats as well.
Well, Samit, it's interesting. I've been in a couple of big conference calls just because of that this week, because as it's such a crucial time, there's research that's becoming available almost on a daily basis. So a lot of assumptions that we're testing are things like, how long does the virus live in the environment? Mm-hmm. What surfaces does it live on? Can I get it from my cat? Mm-hmm. And so there's some pretty current information, like within the last week, that's pretty relevant to what people are worried about.
Yeah, for example, I personally heard that it lives longer on metal surfaces and plastic.
It lives on non-porous surfaces for a longer period of time than porous surfaces. So you could think of porous surfaces as being something like cotton, any kind of fabric. That's a porous surface. A non-porous surface is, as you say, is steel or solid plastic, things like that. So there was a study that was just published, I think it was out of South Korea last week, that demonstrated that the virus, if you inoculated something porous like cardboard with COVID-19, that within 24 hours there was absolutely no evidence of virus present on that porous material. So the virus doesn't last long on that type of material. So that means you can't get it from your cat because fur is both porous and fibrous. So the likelihood of your being able to catch it from your cat is very low. That doesn't mean you shouldn't wash your hands after you play with your cat, but it makes your cat or dog, for that matter, the lesser species, a little bit less of a concern. And we all need to know what we should be worried about and what we shouldn't.
So since we just switched to the cats, I know surface-wise, maybe just because you just mentioned it's not that easy for us to get it from your cat, but what if can your cat have it and then groom you, or can you get it from your cat's saliva or something like that?
You would think so, but there's no evidence for it. And this has been something that people have been looking at ever since the virus appeared in China. And there just doesn't seem to be any evidence that humans can contract it from their pets. Now, we also know that pets can contract it from people. Mm-hmm. And so if you test positive for COVID-19, you do need to be careful about not giving it to your pets.
Yeah, as of end of March, just this fresh news came in that actually at least one cat that they know that double tested for it to make sure if it got it or not. And in Belgium, this cat got it from the owner who just recently traveled from northern Italy region back to Belgium, and the owner was positive for COVID-19.
That's correct. What we don't know, it did make the cat sick. The cat developed some pretty significant respiratory signs and some gastrointestinal signs. What we don't know is whether or not that was entirely the fault of the COVID-19 virus. The cat could have had other kind of immune suppressive disorders, could have had other secondary illnesses, and nobody knows whether that was the case or not. They do know that the cat's feces tested positive for the coronavirus, but nobody still knows what kind of test was done.
Yeah.
So there's a lot of questions still about that.
But I think the good news is what I read is that after 9 days of treatment, the cat is doing well now.
Cat seems to be fine. Yeah, absolutely. And supportive care, just like you would do for yourself.
What do you think about another thing I get a lot of questions from clients and in my surroundings is mail. People are a little bit worried about mails coming in and going out. What do you think about mail? Well,
mail is the same thing as money or boxes of packages from Amazon and things like that. All of those materials are porous materials. Mm-hmm. So paper, money, cardboard, all of that is not likely to carry the virus, at least for any length of time. That said, that means you don't need to spray down everything with a disinfectant. But what you probably ought to do if you take money from somebody is to wash your hands again for 20 seconds before you touch your face.
Mm-hmm. So, and the same goes for clothes too, because that same applies for your clothes. You do not have to, immediately wash your clothes or spray them down when you come home.
Oh, no, but, it always makes sense to be cautious about it, especially if you've been in an environment where you don't know, if there's been any level of crowding. I was drove by Trader Joe's the other day, and there were people waiting in line to get in there.
Oh, yeah.
Now, in that case, I would take all my clothes and launder them because I was probably standing a little bit more closely to somebody than I should be.
Yeah, the 6 feet social distancing measures sometimes can be broken, especially when everybody's trying to get the grocery shopping done.
Well, the last dozen eggs or whatever. Now it was toilet paper. Now apparently it's eggs.
It is eggs now, yeah. And actually, I couldn't find bread flour the other day as well.
Well, it appears that there's such a thing called stress baking.
Oh, okay.
And so people are home baking bread and making muffins and things like that. And my husband used to be a baker. He used to have a commercial bakery here in Chico. And so he can't really quite get his mind around the fact that there's such a thing as stress baking.
My wife, Lori, started making bread at home suddenly every day now.
Oh, dear.
We don't want to go to the grocery and buy bread, so... Interesting. So before we close, though, this mini podcast, I kind of want you to tell us a little bit about what we do here, because I feel like it's so important that we are still, operating for, as an essential part of the community, trying to do our best to minimize contact but still offer our services. We
are considered an essential service, Samit, because people have pets, and just like other health problems don't stop in people, they also don't stop in our cats. And so we have implemented very strict levels of social distancing in terms of we have not had a client in the building for the last 2 weeks. We go out and meet the client with 6 feet apart. We disinfect the carriers before we bring them into the building. We're even it's very hard for us because we do procedures to practice social distancing for ourselves. So what we're working on is doing the best we can there, but also talking about making sure that the people we live with at home are being very careful so that we don't bring anything into the building. So, and we're disinfecting constantly. Every time anything happens, we're out there with the bottles and so on, and wearing gloves to bring the cats indoors and all of that. We're also starting telemedicine.
Yes, next question.
So that's a really important part. And so if there's a need for a consultation with a doctor or a follow-up visit or a recheck or an assessment for whether or not that cat should be seen again, we can do that all online now.
Yeah, telemedicine, when the circumstances are right, is very useful, and you found great interface for us to use, some software or websites to use. It's easy for the client, it's easy for us to set up, and it's effective in some situations.
It is, and we've also, Samit, you set it all up. We have laptops set up in the exam room so the doctor can, while he or she is talking or doing a physical exam, is actually interacting with the client who might be sitting at home or waiting out in the car.
It's interesting how much we have to think about details now. For example, instead of exchanging a credit card hand-to-hand or exchanging cash money, we are encouraging to use over the phone or online payments. So that's another thing we immediately try to integrate to our system so people can actually pay remotely as well.
Right. And we're text messaging people much more often than we did before. We're asking people not to bring anything from home when they come for a visit, and asking them to send us a history rather than bring a piece of paper with them. So there's all kinds of things that we can do to keep ourselves safe and still stay able to take care of people's beloved cats.
Personally, I would like to tell everybody to, encourage everybody to stay home, absolutely, if they don't have any essential needs in these hard times, at least for a little bit more, for a while.
The the Centers for Disease Control says that the next 2 weeks are the most important 2 weeks to be at home and keep yourself isolated, because the peak of the infection and the pandemic in the United States anyway will be in the next 2 weeks. So we can save lives and keep each other safe by staying at home.
And this just reminds me, before we end it, this is great time for you to increase your playtime with your pet, to pay attention to your pet, isn't it? Though you're home, maybe sometimes you wanted to do more playtime, but you always were on the go, and you were working and you had homework, whatever your lifestyle was. Now you do have this extra time to say, wait a minute, I'm gonna play.
And there's nothing better for us and for our cats than to interact with them. And we're teaching one of our cats to walk on a leash now. That's one of our big goals, so that he can go outside safely and go for walks with us. And we hadn't had time for any of that. Mm-hmm. So we're working on that now. Yeah.
So spend more time with your cats and with your pets and with yourself. Perfect time for individual improvement as well. Take some online, webinars or education. Just I'm sure everybody can find something to do with their time.
Everybody has interests outside of work. This is an opportunity to explore those.
Well, thank you for joining us, Doctor. I appreciate it.
You're welcome. It's been fun.
All right. See you guys next time. Our podcast is on chicocast.com, on Spotify and Apple Podcast.